like to introduce my friend, Dr. David Ledgerwood, who's going to be presenting on the subject matter today, gambling, impulsivity, addiction, and the brain. Dr. Ledgerwood is a clinical psychologist and associate professor in the Substance Abuse Research Division at the Wayne State University School of Medicine in Detroit, Michigan. He's also the director of the Problem Gambling Clinic at Wayne State, and not the president, but the secretary.
Right.
At the Michigan Association on Problem Gambling. Dave, it's all yours, man.
Yeah. All right, Robbie, thanks again.
Yeah.
And thanks everybody for being here on looking out my window is a beautiful sunny day, and considering I'm not that far away from a lot of you guys, it's probably fairly sunny there too. So hopefully some of you are sitting on a back deck or a front porch watching this webinar. I'm going to jump into it today. So for those of you who've seen some of my webinars previously, you know that I'm both a problem gambling researcher and an addictions researcher more broadly, studying substance use and nicotine and tobacco use, gambling, other behavioral addictions, and so forth. And I'm also a clinical psychologist, so I do clinical work with people with addictions as well. So I really try and understand how the research piece would fit with my clinical work and the clinical work of other people if they're consuming this research literature. And one of the areas where I think that can get a bit bogged down is when we're talking about brain function. I'm not a neuroscientist myself, but I work alongside a number of neuroscientists, and I really respect their work. A lot of the work that I do is sort of related to that in terms of executive function, impulsivity. And so today what I wanted to do is give a bit of an overview of a few perspectives on sort of what we study when we're studying the brain among people with gambling problems. And I'm hopeful that will sort of feel like it's relevant in terms of giving you guys, in terms of clinical work, a little bit of understanding of what the brain processes are that are going on with people who have gambling problems, and also how those problems might be similar to people who have substance use disorders as well. Because most of the work that's come from in the gambling disorder area has come from the substance use and nicotine disorder use area rather than other areas of mental health. So as we go through, that might sort of spark some discussion as we can talk about how this might be relevant to clinical work. Now, one of the major themes that I often sort of harp on, and I think is really important, is the sort of idea of risk and reward when it comes to gambling disorder. And many of you may have seen these definitions of gambling before. They're very basic. One definition is to play a game for money or property, or to bet on an uncertain outcome, or to stake something on a contingency and take a chance, so there's an element of risk there, or more directly, to place something of value at risk for the chance of obtaining something of greater value. So the idea here is that we can take our money, we could take our property, we could take other things that we value, put it up against some contingency, some chance of actually increasing that amount of money, and we consider that gambling. And of course, we often think about casino gambling, lotteries, those sorts of things. We don't often think of other things, but I've worked with people who are day traders, who engage in other forms of gambling, just gambling on just chance events and so forth. Anything can be gambling. It's about risk and it's about reward. And that's oftentimes what we're talking about when we are studying the brain and studying problem gambling among people with gambling disorder. And also what we're talking about when we're talking about people who have, say, a cocaine use disorder, alcohol use disorder. It's the idea of reward, and the idea that engaging in the activity, whether it's gambling or drinking or using cocaine, involves some sort of activation in the brain that's experienced as reward. Now, with gambling, it's a little bit from substance use, because one might say that the winning is the reward. But for a lot of people, money is not the thing that's really the primary reward. It's actually the experience of the gambling and the rush that one gets when they're actually gambling. So as we go through, sort of keep that in mind and sort of trying to understand how this concept of reward and risk and reward, all these things go together to sort of help us understand how the brains of people with gambling disorder are different from people who don't have any addictions, and also how they might be similar to the brains of people who have other sorts of drug-related addictions or alcohol-related addictions and so forth. And a lot of this research that we're going to talk about involves functional magnetic resonance imaging, which involves using a very large magnet to align oxygenated blood cells that have iron in them in the brain to determine what parts of the brain have greater activation during what types of tasks, or something else called PET research, which is where you put a radioactive tracer inside the body, and you can tell what sorts of receptors are firing by the amount of certain neurotransmitters that are between synapses of the brain cells. So what I'm going to talk about today essentially are three different ways that we've looked at brain functioning in the area of gambling disorder.
Hey, Dave.
Yeah, Rob.
Sorry. I have. Can everybody hear? Someone is chatting us that they can't hear. You sound good coming through these earphones, through my medium. Anyways,
Okay.
I don't know if anyone else is. Is anyone else experiencing any? Oh yeah, everybody else is saying they can. Yeah. Okay. A little bit of both, but but anyways, yeah. Some people are.
We
But
having
yeah.
technical problems?
No, I think it's okay. If you could maybe speak into maybe the microphone. Just a couple are saying they're not here. Most are saying they can. But yeah,
I'll throw these on.
Okay.
Because it might actually improve the quality. I use a Mac, which has pretty decent microphone, but I can imagine sometimes it's not perfect. So
no worries. Yeah. Okay, folks. So we're going to try the microphone out. Yep.
And is that better?
Well, it's the same for me. You've sounded fine. Well, someone just said way better. So
okay. Well, let's go with that. All right.
I appreciate you doing that, Dave.
Not at all.
No worries, man.
I'd rather people be able to hear me.
Okay.
And I'm really glad that people can. So
okay.
Yeah, this is perfect. So what I'm going to talk about today are these primary areas of what we call reward processing and paradigms around reward processing. We're going to talk about something called a near-miss phenomenon, and we're going to talk about a paradigm of studying the brain in addictions called the craving and cue exposure paradigm, and talk about how that might look in terms of what we found in terms of findings of people with addictions and who don't have addictions. So a couple of things to sort of consider when we're talking about the brain and we're talking about reward processes. A couple of quotes. One is by George Koob and his colleague Lamal in an article in 2008. That was basically a major process in addiction involves a compromising of the reward system through chronic underactivation of natural motivational systems. So what we often find in people with addiction is there's essentially this compromising of the natural reward system. So for example, the things that generally we find rewarding, like being in a relationship or getting a birthday present or those sorts of things are devalued in addiction in favor of the drug of abuse, right? Or the behavioral activity that the person has addiction to, that sort of takes over the addiction, the motivational systems of the brain. Kalivas and Volkow had a very similar, actually Nora Volkow is actually the head of the National Institute on Drug Abuse in the United States and the NIH, and George Koob is actually the head of the National Institute on Alcoholism and Alcohol Abuse. But Nora Volkow and Kalivas said basically addiction disorders create a dysregulation of cellular and circuitry functions in the brain such that non-drug motivation stimuli lose salience, decision-making abilities are impaired, and there's a profound activation of the prefrontal cortex, which is the frontal parts of the brain, and the glutamatergic drive, which glutamate is a neurotransmitter that's important in reward processing the brain, to the nucleus accumbens when predicting drug availability. So again, this idea that if you have a drug addiction, if you're exposed to cocaine and you take cocaine, or you even exposed to cocaine cues, that can actually hijack the reward system, so that when you're exposed to things that are naturally rewarding or reinforcing, there's much less of an activation in your brain, and it's sort of all taken over by the addictive substance or behavior that you're engaging in. So there's been a lot of work over the years on substance use disorders. There's been a little less work on gambling disorder, but a lot of the work on gambling disorder has been in an attempt to try and tie what's happening in the brain of people with gambling use disorder to this process, this hijacking of the reward circuitry in the brain. And when we're talking about the brain, I don't want to get too in depth here. Just a couple of slides about different parts of the brain and sort of what they do. When we're talking about our reward circuitries, we have this part of the brain that's sort of in the middle where dopamine is produced and transmitted, called the striatum. The striatum is made up of a number of different parts, like the nucleus accumbens and the putamen and other parts where dopamine is produced and then transmitted to other parts of the brain. And this striatal part of the brain, the center reward portion of the brain, is connected to sort of the frontal parts of the brain. You'll see here anterior cingulate, the dorsolateral prefrontal cortex, and the ventral medial prefrontal cortex. These are at the front of the head, the front of the brain. And collectively, I'll just talk about them as the prefrontal cortex, the parts of the brain that are often involved in learning from our experiences. They're involved in something called executive functions, or ability to plan out complex tasks and activities that help us learn from our experiences, that we maximize our benefits and minimize our punishments, right? So when we engage in an activity that is rewarding, we experience reward in this sort of striatal part of the brain. The information is sent to the prefrontal cortex, and prefrontal cortex says, oh, okay, what do I have to do to get that reward again? And that's the part of the brain that's sort of the planning part of the brain. It's part of the brain that keeps us out of trouble. If we have damage to this frontal part of the brain, we might be considered more impulsive and engage in things without thinking so much. So those two areas are probably the most important areas of the brain, but there are a few other areas that are also important. One's called the amygdala, and the amygdala is a part of the brain that helps us to process emotional experiences. So for any of you who have taken sort of intro psychology, this is the one that always stuck out for me. It's the part of the brain where if you're experiencing something that's rewarding, that's going to be experienced as a positive emotional experience. If you experience something that's punishing, that's going to be experienced as a negative experience. And we have something called the hippocampus. The hippocampus helps us turn those emotional experiences into memories, emotional memories. So we have this idea of sort of we understand what was rewarding and under what circumstances and how we get that again. And our hippocampus helps us sort of remember those things. And then we have this other area of the brain called the insula, or the insular cortex. And this is a really interesting part of the brain. I'm just going to move on to this next list. So we've got the striatum. Nucleus accumbens is part of that striatal part of the brain. Dopamine levels when drugs or gambling are on board. Cues can result in dopamine release to the nucleus accumbens. Prefrontal cortex are executive function regions, hippocampus, memories, amygdala, emotion. And then this insular cortex that I'm showing you at the bottom. This is basically the part of our brain that allows us to be self-aware and to be cognizant of what's going on with us. So it allows us, for example, to realize when we're craving gambling or craving drug use. And without this level of self-awareness, it'd be very difficult to have an addiction. I'll talk a little bit about that in a little while, because if you're not self-aware of what's going on with you, then you're really not going to be aware that you are craving or urging a drug or to gamble. We'll talk about that in a little bit, but first of all, I put my poll questions a little bit sooner in the presentation, so jump in now, Robbie, and if you want to pop up the poll question.
Yeah, thanks, Dave. I was taking notes, man. That was that was good stuff. I have questions, but let's launch the poll question first. Okay. Poll question number 1. What part of the brain allows us to be self-aware? Is it A, nucleus accumbens? Did I pronounce that right, Dave?
Accumbens.
Accumbens. You just said that. Yeah,
Yeah.
accumbens.
Accumbens.
Or B, insular cortex.
Right.
C, pyramidal tracts, or D, the hippocampus. What part of the brain allows us to be self-aware? Is it A, nucleus accumbens? B, is it insular cortex? Is it C, pyramidal tracts? Is it D, hippocampus?
Okay.
Really interesting stuff, man.
75%-ish going.
Yep. Let's get long-term goal is 90% plus. Stretch goal, we're at 81%. Can we get above 81%? Let's do T minus 10 at this point in time. 83%.
All right, 85. Come on, guys.
Yeah.
You can do it.
What part of the brain allows us to be self-aware? Is it nucleus accumbens, insular cortex, pyramidal tracts, or is it hippocampus?
Right. 89%. Come
89%.
on, you 11%. How long
One more can hit it.
One more, come on.
I don't know if we're going to hit it, Dave.
I don't think so. We got 49 out of 55.
Yep.
So
okay. All right.
Okay, so the insular cortex, the insula, as we sometimes call it as well, is the part of the brain that allows us to be self-aware. So our consciousness, our self-consciousness is sort of housed in the insular cortex. Like, as I was just saying, it's that part of the brain that allows us to experience when we're experiencing an urge to engage in an addictive behavior, for example. The nucleus accumbens is actually a part of the striatal part of the brain that's involved in dopamine production, so it's more of a reward processing piece. Hippocampus is that emotional memory storage, right, where we create memories related to addictive behaviors. The pyramidal tracts was a little bit of a throw-in. If any of you are a fan of the vacation movies, if you ever saw one of the worst vacation movies was European Vacation, they were on that game show at the beginning.
That's right.
This was the question that they got, the really smart family got wrong. So just throw that in there.
Very good.
All right, so we'll move on. All right, good job, guys. So we're moving on to reward processing. And we're going to talk a little bit about this in sort of perspective of gambling disorders. And when we're talking about reward processing, we're often talking about sort of the extent to which, when we're gambling on something, or we're doing something risky in our life, we're basically doing some mental gymnastics. We're basically weighing our options, weighing the cost of the thing we're putting at risk and the potential value of the thing that we could potentially get back. So we know that gambling involves placing something at risk in order to obtain something of greater value. However, we generally take calculated risks where the potential reward is consistent with the payoff. And some of you, I may have presented this to you at some point in the past, but these odds in the bottom right corner are actually odds of winning the Powerball lottery. And it's a couple of bucks to play, obviously, so the risk is not very great. And you could win millions of dollars. But what are the odds of winning millions of dollars? Well, the odds of winning the grand prize is one almost for every person in the United States, 1 in 292,201,338. So your chance of actually winning Powerball is next to nothing, even if you bought a lot of tickets. Your chance to win $1 million is still almost 12 million, 1 in 12 million. Your chance of winning $4, we have two odds here, two ways to match it. One is 1 in 92, one is 1 in 38. So even when it comes to small wins, the chance that you're actually going to win anything is next to nothing, is very little. However, a lot of people buy the Powerball because it only costs $2. You're only risking $2. And I would argue as well
that oftentimes what people are doing when they risk that $2 is they're not actually buying the chance to win the lottery. They're buying a fantasy for a few hours. They can imagine how they would spend that money if they actually did win. You know, would they buy a yacht? Would they buy a mansion? They buy like 12 Lamborghinis? You know, they're actually buying something other than the chance to win the money. But when we look at this, we think, you know, most people make these kind of risks. You know, they might spend $2 with the chance of having, you know, this huge payout, and just with having sort of the dopamine rush of the fantasy of the fact that you may win. Well, when it comes to dopamine, we're talking about dopamine receptors in the brain. There are different types of receptors in the brain that dopamine basically connects to. And in the addiction world, there have been sort of two primary areas in the striatal parts of the brain that have been the focus of the most study, and those are D2 and D3 receptors. It's D for dopamine, of course, and there's a number of different sort of types. There's a D1 receptor, there's a D4 receptor, in this case, D2 and D3 receptors. And throughout numerous research studies in the substance abuse world, they've shown and replicated that there are reductions in D2 and D3 dopamine receptor availability in the brain for most substances. So nicotine, alcohol, cocaine, methamphetamine, and among people who are addicted to those substances. And you can see that in the diagram on the left-hand side by Nora Volkow. This is actually a classic figure from one of her early imaging studies looking at methamphetamine abuse. And they did something called a PET imaging study where they put a radioactive tracer in, and then they take images of where it sort of shows up in terms of activation in the striatal middle parts of the brain where reward seems to take place. And what you see here is that in the healthy control participant, there's a lot of activation. It's very sort of red, that shows greater activation, it's sort of larger than in the person with methamphetamine dependence. And what this is basically showing is that in people with addictions, there tends to be a downregulation or reduction in those D2 and D3 receptors for pretty much all drugs of abuse. And so there's been some research on this to sort of look at whether this is also true in gambling disorder. And there are a handful of PET imaging studies that have actually looked at gambling disorder and compared people with gambling disorder to people who have no addictions on dopamine D2 and D3 receptors. And so one of the first studies done in 2009 was conducted by Steves and colleagues. Steves and colleagues actually did something a little bit unusual. They looked at dopamine D2 and D3 receptor availability in a problem gambling group who had problem gambling or gambling disorder that was secondary to Parkinson's disease. So many of you may already know that research in Parkinson's disease patients has shown some D3 receptor agonists, so basically medications that increase receptor availability for D3, like pramipexole and L-dopa monotherapy, are linked to reward-driven behaviors, including gambling, shopping, and hypersexuality. So what we found in the literature is, in some cases, people with Parkinson's disease, when they take these medications that increase dopamine receptor availability for D3 receptors, are likely to develop gambling problems, to develop compulsive sexual behaviors, to develop compulsive shopping behaviors and so forth. And usually what happens in those cases when those behaviors sort of emerge, then they basically reduce the doses of the D3 receptor agonist medication that's specifically to treat the Parkinson's symptoms. And that usually causes the compulsive behaviors to go away. Well, Steves and colleagues actually looked at this particular subpopulation of people with gambling problems and found that there was a significant decrease in both D2 and D3 receptor availability among those people with Parkinson's disease who developed gambling problems secondary to their Parkinson's medication. Now, this is a very mixed finding. This is not a finding that's been found in a number of other studies. There's one other study that I will sort of talk about, is another study by Jousta and colleagues, who did a very similar um, experiment, but this time with people who had gambling disorder and healthy control participants who didn't have Parkinson's or any other sort of condition where they would need dopamine agonist medication. And when he looked at these two groups, he did not find a significant difference between the problem gamblers and the control participants with regard to dopamine receptor availability. But what he did find was that when he looked at only those who had gambling disorder, there was a significant correlation in D3 receptor availability depending on the severity of the gambling disorder. So the more severe the gambling disorder, the dopamine release was positively associated with gambling severity. So the more severe the gambling disorder, the greater the dopamine release. So there have been a couple of studies that have found reward processes to be different among problem gamblers. But again, with regard to the dopamine studies, the results are actually quite mixed. We don't know for sure if what we're seeing is sort of exactly like we would see in a cocaine use disorder or other type of substance use disorder. We have some sort of evidence that that might be the case. Now, another area of study that sort of focused on how people with problem gambling focus on rewards is this idea of a near miss phenomenon. So if I were doing this not as a webinar, but in a room with all of you, I'd probably ask for you to tell me what a near miss phenomenon is. But instead, I'll just sort of, I'll show you, basically. So most of you have been probably at a slot machine at some point, and you've pulled the arm or you've pushed the button, and you get like a bar or a 7, a bar or 7, and then the similar icon, except it's just above or below the pay line. So here in this picture, you'll see that there's a 7 and another 7, and then there's a third 7, but it's above the pay line. It's just a little bit above. So that's what we mean by a near miss. Is this idea of when we almost won. We actually totally lost. You know, you don't get any payout with this kind of result, but your brain actually reacts as if it was a win. And we'll talk about that to a little bit, how this sort of affects people with gambling problems. So what is a near miss? Characteristic of many gambling games. It's the idea that you just missed a win, and it recruits similar brain regions to clear wins, despite the fact that it's actually a loss. The main responses in that area of the brain called the striatum, the ventral striatum, which is that reward region of the brain. And it's also one of those things that when people experience a near miss, when they're at a slot machine or other form of gambling, they may sort of take that as oh, I almost win. Maybe I have some level of control or skill with regard to this machine. And maybe if I keep on playing, then I'll get better at this and I'll actually win more. And it's also associated with dopamine production and release of dopamine in the brain. There's a number of studies that have been done by a neuroscientist by the name of Luke Clark, who was at the Cambridge University in the UK for several years, and now he's at University of British Columbia in Canada. And he did a number of studies where he created basically a paradigm where he created like a slot machine task that people could do while they're in an fMRI, basically. So while someone's lying in the MRI getting pictures of their brain, the person will be pressing buttons to make a wheel spin that's projected on the side of the scanner, so they can sort of bet certain amounts of money. And in one of those studies that was actually published in 2016, he worked with a number of folks to see if certain medications might affect dopamine and how dopamine is produced in the brain, how it's produced when someone experiences a near miss. So the idea behind this particular study was that enhanced gambling induced dopamine, enhanced gambling induces dopamine release in the striatum, the ventral striatum in the brain. We talked a little bit about Jousta's study that found that dopamine receptor binding in certain parts of the brain, including a part called the substantia nigra, which is an important dopamine production part of the brain in the striatum, is positively correlated with problem gambling severity. High dopamine levels are associated with increased risk-taking in healthy humans. So the greater the dopamine, the more people who don't have addiction are more likely to take risks in gambling tasks. And D2 and D3 receptor agonists increase risk-taking. So the idea here, what they hypothesized was that if they could alter dopamine transmission by using a D2 or D3 receptor agonist, in this case it was a medication called sulpiride, that would alter striatal responses to near miss in people with gambling disorder, in this case pathological gambling, because they used the old DSM-4 criteria. And so they recruited 22 individuals diagnosed with gambling disorder, 22 individuals who were control participants who had no addictions whatsoever. They were all men, just to keep it, I think, consistent in this study. And they tested these folks once after 400 milligrams of sulpiride and once after a placebo. And those doses were actually randomly counterbalanced. So half of the participants got the sulpiride first, and then the other half got the placebo first, so that there wasn't any expectancy effect that would sort of mess up the data. And so the test sessions were actually separated by at least a week. They used a two-reel slot machine that Luke Clark had created for a number of other studies that looked something like this. So as you will see, the participant would basically see these reels spin. They would pick sort of an item, and it would be validated. They would push a button, and the other wheel would spin. And if the participant got an icon that was identical to the one that they had chosen, then it was a full-on win. You'll see at the top, if they got an icon that was completely different from the one that they had chosen, that was a complete loss. But if you see at the picture at the very bottom here, if they got a picture that was different from the one that they had chosen, but there was one that the one that they had chosen was either one above or one below the box that they had, that was sort of the winning spot, that was considered to be a near miss outcome. So it's the same as the sevens on the 3-7 machine, right? It's just a little bit above or a little bit below being a winning outcome. So they basically, participants got some money if they had a win, and they lost money if they either had a full-on miss or a near miss outcome. And ultimately, by the end of the study, they got to keep the money that they won. They didn't go in the hole, so they didn't have to pay the researchers anything at the end of the study if they lost a lot of money. One of the things that they did when they were doing the slot machine is as soon as they asked, as soon as the person won or lost or had a near miss outcome, a little question would come up on the screen that would basically ask the participants, how much do you want to gamble again? How much do you want to play one more time, sort of thing. So that was a measure of motivation to keep on gambling. And if we look at the participant scores here, you'll notice on the left-hand side, the left-hand graph has control participants in the dark gray and people with gambling disorder in the light gray. Not surprisingly, those with a gambling disorder were significantly more motivated to continue gambling regardless of the response, whether it was a win or a loss or a near miss. When we look at the graph on the right-hand side, this breaks up data by win status, so win, near miss, or full miss. And what we actually see here is, not surprisingly, if a participant won, then they were significantly more likely to want to play again, to continue to play. That was significantly higher than both a near miss and a full miss. But when we look at the results for the near miss, so the near miss is in sort of the middle gray bar, and the full miss is the light gray bar. Even though it doesn't look like a huge difference between those two groups, it was statistically significant, where the folks, when they got a near miss, were significantly more likely to say that they'd like to continue playing than if they got a full miss. Now, one of the things that we don't have from this study, because it wasn't published in the study, is something called a interaction term, where we could see if these responses differed by gambler status, controls versus problem gamblers. And that might be because that interaction wasn't statistically significant between the two groups. But we are seeing, to a certain extent, what we'd expect to see in the motivation to keep gambling. Now, this is sort of a complicated graph that I'll sort of try and describe here. This graph at the top, these sort of colored in areas in the brain actually show the striatal parts of the brain. So the reward pathways that we've been talking about, nucleus accumbens, substantia nigra, other areas that are in the brain that are involved with dopamine production. You'll see here that the brain on the left-hand side towards the top is control participants, and the brain on the right-hand side is problem gamblers. And what we're seeing here in the control participant brain is that there's a significantly greater activation striatal parts of the brain for near miss than for a full-on loss. So in people with gambling disorder or without gambling disorder, people who are healthy controls, we would experience a near miss as more of a win than more of a loss, actually. When we go to the right-hand brain, on the right-hand side here, we see the exact same regions of the brain and the same results, except this time it's with the people who had gambling disorder. And what we're seeing here is also that a near miss resulted in greater striatal activation than did a full-on loss. We're seeing it's much brighter. There's a much stronger relationship here. So what we're seeing is that among people with gambling disorders, their response to near misses is significantly stronger than it is for people who don't have gambling problems. When we are looking at this graph at the bottom and sort of the graphs that are associated with it, we look at the sort of the left and the right areas of the striatal parts of the brain. We're seeing very, very similar findings for each of those. Among the control participants, you see greater activation for a near miss and a full miss. And for the gamblers, you see sort of greater activation for a near miss than a full miss, but you see that the magnitude between the two is pretty substantial for the controls and the gamblers. And same with the right-hand side of the brain too. We see very similar results to what we see at the top. Now, when they looked at the sulpiride findings to see if adding that dopamine agonist actually affected the regions of the brain and the amount of reaction to the near miss versus full miss, we see that both for the controls and for the problem gamblers, there was no effect. So we see placebo versus sulpiride for the controls. They look pretty similar. And we see for the placebo versus sulpiride for the gamblers, they look pretty similar to each other. So changing dopamine receptor availability does not appear to change the reaction, the difference in the reaction to a near miss versus a full-on loss. So in conclusion for this particular study, which I find to be a really interesting study, reward pathway responses to near miss are definitely amplified in problem gamblers compared with control participants. There was no modulation of the brain response by sulpiride, and the authors actually, in this quote, say this finding fits nicely with the idea that near misses hijack the reward system and generate aberrant learning about skill acquisition. So what the authors are basically saying is what many of the researchers in the substance abuse field have said, is this idea that addictions hijack the brain. They hijack the brain in ways that are predictable and are much greater among people who have the addiction, the gambling disorder, the cocaine use disorder, than in people who have healthy controls. But I will also say that Because as I've been doing work in gambling disorder for a long time, some people who have never had an addiction, who have never experienced addictive disorders, can develop gambling disorder in later life. And part of that is because even among people who don't have addictions, our brain works in such a way where we can be tricked, essentially, where a near miss, for example, can be perceived as a win or not perceived as a loss. And we can also be tricked, for example, if we have a very large win early in our gambling career, and that leads us to gamble more and more to sort of chase that win. So even though we see a lot more of this among people with gambling disorder, we also see it among people who don't have gambling problems. Poll question number 2. Robbie, you want to jump in?
Yes, very fascinating stuff, Dave. I really like that that study on the near miss, how gamblers with our problem gamblers, they respond so much more than just I guess the placebo, right?
Yeah.
I mean, anyway, so I'll launch the poll question here, and it asks, what might be an example of a near miss? Speaking of a near miss, is it A, you go bust in a blackjack hand? Is it B, you lose a poker hand with 2 pairs? Is it C, you lose on 3 scratch-off tickets but win $5 on the 4th? Or is it D, your slot machine shows 3 bars that are not quite aligned? Is it A, you go bust in a blackjack hand? Again, this is an example of a near miss. Or is it B, you lose a poker hand with 2 pairs? Is it C, you lose on 3 scratch-off tickets but win $5 on the 4th? Or is it D, your slot machine shows 3 bars that aren't just quite aligned? And we're at 76% who have voted, so we're out of the gates pretty quick.
Great.
Let's see if we can beat 89%. Right? Yeah.
Right.
Yeah. Well, that was a great study. I don't know if I remember that one from your other talks. Yeah, that's good.
Yeah, I try to add new stuff
Yeah.
whenever I can, just to, even if
really good.
because this talk comes up from time to time, this brain talk, so I try to add a few new things here and there.
Okay, we've already beat it, but we'll give 5 more
right.
seconds. We're at 91%. Let's see if we beat that. A few more seconds here.
Nice.
And then we'll shut her down.
So close.
Yes. Yeah, exactly.
I think that one person might have been having a nap
91%.
during the first one.
Yeah. All right, we'll close it.
Okay. So very clear winner here. Your
Yes.
slot machine shows 3 bars that are not quite aligned. Yeah, exactly. I mean, that the classic example is the 7, 7, and 7, and just unaligned there. I might give the poker hand, a correct there too. So you lose a poker hand with 2 pairs. If you think about it, it's like, if you can sort of look at the gamble that you're doing and say, oh, I almost won, right? Then that could very well be, if you're sitting at a poker table and you're playing poker and you feel like you got a couple of aces and a couple of 10s, I think that's a pretty good hand. I might win this one, but then you get beat with a full house or something. Obviously, you lost, but at the same time, during the time that you're actually doing the gambling, it could feel like you're almost winning. If you go bust a blackjack hand, that's where you keep hitting and go over 21, so you've clearly lost. If you lose on scratch-off tickets, but you win $5 on the 4th, you might consider that. That's almost like what I sort of have seen in slot machines in the last few years. You play penny slots, you might put $1 into the slot machine and you might get 50 cents back, but the bells and whistles go off saying that you still won. It's not quite a phenomenon like we're sort of describing here, but it probably does lead to changes in the brain that are sort of similar to what we're experiencing with a near-miss phenomenon. All right, and the last sort of area that I want to sort of focus on is another way of studying gambling rewards and processing of rewards is through cravings and cues. And of course, uh, for many of us, these are the things that sometimes we crave. So food, like sweet foods, savory foods, stuff that we really shouldn't be eating very often. You'll notice the guy in the middle is looking at the piece of cake and he's ignoring the apple. Uh, we know that this is something actually in the food literature that people do sort of experience cravings for sweet, high-fat, salty foods at the expense of healthier foods, and that's also associated with things like food addiction and binge eating and other sorts of things. But it's also sort of a natural thing that all humans do, right? Well, it's also true that these things are sort of relevant to the addictions as well, substance use disorders. So craving and gambling disorder is similar to those in substance use disorders, including cocaine use disorder. And in the research that we've done over the years and that many of people have done, they usually have focused on cocaine use disorder to be the one substance use disorder that probably has the most similarity to gambling disorder in terms of how it affects the brain and how people respond to it in terms of rewards. So previous studies have found important similarities in brain functioning between gambling disorder and cocaine use disorder, including reward, executive function areas like the prefrontal cortex, our friend the insula, for example, the anterior cingulate, which is also part of the frontal parts of the brain, the executive function parts of the brain as well. There was a really interesting study that was published in 2016 by Mark Potenza's group at Yale University. They're interested in brain activity of people with cocaine use disorder and people with gambling use disorder when they were exposed to videos that were basically cue videos, so gambling videos or cocaine use videos, to see how that affected brain response among people with cocaine use disorder and gambling disorder. So they recruited 114 individuals who had cocaine use disorder, gambling disorder, or were healthy control participants with no addictive disorders. And they had each of them watch different videos. And the videos depicted cocaine use, gambling, or otherwise neutral sad scenarios. So something sad was going on the screen, didn't have any drug cues or any gambling cues. And for each of these, basically what they did was they had the people in the MRI machine, but they also asked them the intensity of their gambling and their drug craving during their experience watching each of these videos. And so the video, or the graph on the left-hand side, you'll see is the intensity of drug craving while watching the videos. The videos are in the bar graphs. The green videos are the gambling videos. The cream-colored ones are the cocaine videos, and the blue videos are the sad videos. And as you'll see here across the bottom, among pathological gambling participants, there was no difference in intensity of drug craving across the three types of videos. Same with the control participants. But when you look at the individuals with cocaine dependence, you see there was a significant difference here with much more intense drug craving while watching the cocaine videos than while watching the gambling or the sad videos. Not a big surprise here. So people with cocaine use problems are more likely to experience drug craving when they see cocaine cues, right? If we look at the graph on the right-hand side of the screen, where they asked about intensity of gambling urges, we see another very predictable sort of set of responses. So there's not much of a difference in gambling urges. There's a little bit of difference here in the cocaine-dependent individuals, really none in the control participants, but we see a substantial increase in gambling urges among the problem gamblers while they're watching gambling videos. So makes sense. And this is a good control manipulation to understand, are the videos effectively, are they being experienced as a cue, are they creating urges in the people that you expect them to create urges in? So they certainly are in this case. Now, the brain regions that they looked at were primarily frontal regions of the brain. So those areas of the brain involved with executive function and those areas that are both involved in reward processing and also in planning out future activities to maximize benefits and minimize our punishments. And again, the videos are the same. So the green videos are the gambling videos, the yellowish videos are the cocaine videos, and the blue videos are the sad videos. And as you'll see here, the results are fairly predictable in terms of activation in these parts of the brain. So during the cocaine use videos, those with cocaine use disorder had the highest activation in these parts of the brain. Those with problem gambling actually had fairly high activation when viewing the cocaine videos as well. But if we look at the bottom, during the gambling videos, problem gamblers also experience significantly greater activation in this part of the brain than did people with cocaine use disorder or the control participants. So urges are experienced in similar ways for both those with gambling disorder and substance use disorder. Cocaine use disorder showed greater activation in the anterior cingulate cortex and the medial prefrontal cortex. So again, these are areas associated with reward and executive function. Activation for the cocaine videos, but gambling disorders did not show greater activation for the gambling videos in that case. Women with gambling disorder actually had greater activation in the insular cortex, the insula, and the posterior putamen, which is part of the striatal part of the brain, than did men with gambling disorder. And you'll remember we talked about the insula being that area, that internal sense of self or self-awareness that can be affected when we're experiencing drug urges or drug cues. So women tend to have greater activation in that area. And I wanted to point out really quickly another couple of really interesting studies in the addiction literature done by Antoine Bashara and Luke Clark. And one was with cigarette smokers, another was with people with gambling disorder. And in each of these studies, what they did was they studied people with these problems who had experienced focal brain damage either to the insular cortex or to some other part of the brain other than the insular cortex. And what each of these studies found was that there was significant disruption in the addiction process when the damage was actually done to the insula or the insular cortex as opposed to other parts of the brain. And this makes a lot of sense. So for example, in this study, some of these folks stopped smoking cigarettes after they had damage to the insula. In the gambling study, you'll see damage to the insula abolishes cognitive distortions during simulated gambling tasks. And this makes a lot of sense because the insula involves being aware of when we're experiencing gambling or drug craving. And so if you're not aware of those drug cravings, then you're less likely to act on them. You're less likely to can follow through and use the drug or engage in the gambling. So obviously we're not going to damage people's insulas, but it's interesting to know that damage to those particular parts of the brain can actually not just increase gambling problems, but could actually eliminate or decrease those problems. I've only got about a minute left, so I'm going to stop here. I do want to put a shout out to Mark Potenza and John Grant for this study, which is published in Psychology of Addictive Behaviors, where they did a very small study looking at whether or not they could predict treatment during psychotherapy and medication for gambling disorder based on responses to a Stroop task. I won't get into what a Stroop task is, but it's an executive function task. And they found that people who had greater activation in the frontal and reward parts of the brain during the Stroop task actually did better in treatment than did people who didn't have very strong activation of these tasks. So this is an effort to start to understand how we can use these imaging studies to create better treatments and to understand how we can move in the direction of getting past some of these reward processing things, which clearly people with addictions have impairments in. We all process rewards a certain way, but people with gambling disorder and with substance use disorder seem to have greater impairment in striatal and frontal parts of the brain with regard to processing these rewards. So I'll stop here. I know we're about at time, but if anyone has any questions and wants to stay on, I'd be happy to answer those.
Yeah. Thank you, Dave. Very interesting stuff. Thank you very much. We've got some questions, and everybody who has to drop off, you're fine. We completely understand that there've been a lot of questions. Well, I'll still get my CU. You'll still get your CU.
Yes.
You're okay. Don't worry.
Very important question.
Yeah, exactly. Yeah, because we understand the importance behind that, and there were only 2 poll questions. That's fine as well. I think most importantly is this has been really some great information. It's funny, Dave, that we when we send out surveys, or we get when we solicit for information on what do you want to see with a lot of these subject matters with these webinars, it's brain chemistry and addiction and gambling. So it's very interesting stuff. So the next couple of minutes, if you can hold on, Dave, if we have any questions, it's just, I think, a couple of minutes past the hour, maybe 1 minute past the hour. We've got a chat that's just come in, and again, if you guys have to leave, I completely understand. Okay, you bet. Ashton asks, this is incredible regarding treatment for these disorders. Has a medication been studied to improve prefrontal functioning for individuals who have suffered from prefrontal damage?
No, I'm running a blank. There are 1 or 2 medications that have been looked at as what you might call cognitive enhancers that are for people who might be more on the impulsive side to improve their executive function. I don't understand, I'm not aware of them being sort of produced to help people with brain injury. But I could be wrong about that.
Gotcha.
Yeah.
Well, Ashton also asked, or behavioral treatments from that might be best fitted for maybe, I don't know, Ashton, or like anyone who's had like a, I mean, would this fall under TBD or TBD, traumatic brain injury? Yeah. Would
actually,
that? Yeah. Go ahead.
Not necessarily. Like most people with gambling disorder don't have traumatic brain injuries that are identifiable, but there are actually new behavioral interventions coming out that do focus on things like executive function and impulsivity.
Yep.
So one is working memory training, for example. Okay. There's been quite a bit of new research in the last little while that's being done currently. Like if we can improve people's working memory, which is an executive function, that might result in reductions in gambling symptoms or other symptoms as well. There are other interventions. Something called episodic future thinking, for example, which is an intervention that's focused a little bit more on delayed discounting. So for those of you who saw Impulsivity talk I did a while ago, I talked about discounting of delayed rewards. We have a tendency to discount delayed rewards in favor of present, much smaller rewards. We tend to pick the small, immediate reward over the big delayed reward. There are interventions that are being developed and tested to improve a person's ability to accept a delayed reward over an immediate reward. And there's some suggestion that might actually help with addictive disorders as well. So there are some behavioral interventions in the works. There's also obviously more research on cognitive behavioral therapy and motivational interviewing, which can have like a psychoeducational component where the therapist actually says, it's very normal for you as someone with an addiction to experience something that a lot of people would think of as a loss, as almost a win, to actually provide the data on the brain functioning.
Yeah. Mm-hmm. Now, very interesting. And Ashton said his agency actually uses CBT, but CBT with TBI makes sense. You're working out your injury, so to speak, right? I mean, you're working on some things. If you have your cognitions about you anyways, Yep. And he says, thank you. I used to work with kids who struggle greatly with impulsivity, and we tried to teach them chess and other games that require future thinking. Very good.
Absolutely.
Yeah. Mm-hmm. Good stuff. So I've got a couple of Q&A here. Well, thank you. And thank you, Ellen. It was good to have you on. My first poll question did not submit. It's okay. Jennifer, I'll take note of that. So,
well, so
yeah.
you're the one who was napping. No, I'm just
Yeah,
kidding.
right. I've got a quick question for in closing with distortions and how they play. Yes, Marie, it was great to have you on too. How they play, and does like the way the hippocampus, or, and I never pronounce this right, the amygdala, A-M-Y, yeah. For instance, like with the positive and the negative emotions that you tie to something, either if it's a substance you take in, or if it's an activity like gambling, or if it's even like eating, like with a process addiction, or, you know, even gambling's considered a process addiction. If there's a brain scan, for instance, Dave, can it be malformed or something wrong there, or with those certain regions that tie into the distortions that can exasperate an addiction? Does that make sense?
Can those regions of the brain have issues, like be
damaged
in some way that might?
Could they be damaged? You know, in other words, that feeds into or exasperates a distortion. Yeah.
There could. I mean, if you have damaged certain focal parts of the brain, it will affect, you know, your behavior. Across the board, we don't generally see that with people with gambling disorder. We might see different functioning in those areas. For example, we did a very small pilot study of delayed discounting in problem gamblers and controls while they're in the scanner. And one of the things that we found was when they chose the delayed rewards, there was greater activation in the amygdalas of the problem gamblers than the controls. And we still don't understand why that is.
Right. Yeah. It's
so we
fascinating.
See different functioning. Yeah. But there's no functional, or there's functional differences, but no structural damage that we really have ever identified in gamblers.
I got you. Yeah. Well, you're getting several compliments now. I think we're done with questions. It was great. And I love looking into this, man. I should try to look into this more because it's fascinating to me. Takes me back to grad school. So anyways,
awesome.
thank you hey, Mary, thank you, Dave. And we look forward to June 12th when we're going to do Espert next Friday, and then we're going to bring Dave back, and Dave's going to speak on a couple of other areas that he specializes in. One of them I know right off the top of my head, you're going to talk on PTSD and trauma and gambling. So looking forward to that. So thanks everybody. Hey, stay safe and stay healthy. Okay.
Thanks
have a good
so much, everyone. Have a great day.
Thanks, Dave. All right. See you guys. Bye-bye.